Introduction. Cardiopulmonary resuscitation is a life-saving technique used during emergencies when someone's heart has stopped beating or they are not breathing. The goal of CPR is to maintain blood flow to vital organs until professional medical help arrives. Assess the situation. Check for responsiveness. Gently tap the victim and shout, "Are you okay?" If there's no response, proceed. Call for help. Dial emergency services immediately. In the airway position. The victim. Lay the victim on their back on a firm surface. Tilt the head back. Place one hand on the victim's forehead and gently tilt their head backward. Lift the chin. Use your other hand to lift the victim's chin upward. Ensure a clear airway. Look, listen, and feel for breathing. If absent, proceed to the next step. Chest compressions hand placement. Kneel beside the victim. Place the heel of one hand on the center of the victim's chest, between the nipples. Place the other hand on top, interlocking fingers. Compression technique. Press down hard and fast, at least 2 inches deep, at a rate of 100-120 compressions per minute. Allow the chest to fully recoil between compressions. Rescue breaths. Give 2 rescue breaths. Pinch the victim's nose shut. Create a seal over their mouth with your mouth. Give 2 full breaths, each lasting about 1 second. New cycles. After every 30 compressions, provide 2 rescue breaths. Maintain the compression-to-breath ratio. Automated external defibrillator, AED. Use if available. Retrieve an AED if one is nearby. Follow the AED prompts for proper use. Attach the pads to the victim's chest as instructed. Chain of survival. Early recognition and activation. Recognize the emergency and call for help promptly. Early CPR. Begin high-quality CPR immediately. Early defibrillation. Use an AED if available. Early advanced care. Professional medical help arrives. Special considerations. Adult CPR. Use standard techniques as described. Child CPR. Adjust compression depth and breaths for children. Infant CPR. Use 2 fingers for compressions on infants. Complications. Rib fractures. Fractured ribs may occur during CPR. Focus on saving the victim's life. Aspiration. Be cautious to avoid excessive airway pressure during rescue breaths. Common mistakes to avoid delaying action. Waiting too long to start CPR can reduce survival chances. Begin immediately if you suspect cardiac arrest. Inadequate compression depth. Compressions should be at least 2 inches deep for adults. Shallow compressions may not circulate blood effectively. Fast compressions. Maintain a steady pace, 100-120 compressions per minute. Avoid rushing or slowing down. Interrupting compressions. Minimize interruptions during CPR. Coordinate with others if available. Neglecting breaths. Rescue breaths are crucial for oxygen supply. Balance compressions and breaths appropriately.